guys, I'm Dr. Sunil Arora. You are watching me at Asa Speech and Hearing Care's YouTube channel, wherein we discuss speech, hearing and psychological disorders. So today's topic is delayed speech and language. This is a very upcoming topic. These days a lot of parents are attending, coming to the OPDs with the problem, with the troubles that our child is not speaking in time. He is very delayed in speaking. So my dear friends, there are a lot of reasons for that, and if you know the reasons, you can really take care of your children at preventive level only. So the reasons can be divided in three broad categories, that is prenatal, that is before birth, perinatal, during birth, postnatal, after birth. So prenatal reasons normally include the mother. You have to consider mother has to stay happy all the times. So the circumstances are like that. She takes a lot of stress, and sometimes she develops gestational hypertension or gestational diabetes, that is raised blood pressure or sugar level may be raised during pregnancy. So this is very important. Don't take any sort of stress. Be cool and calm, enjoy yourself, take a good diet, so that you can nurture. You're carrying a fetus, which is very important to you. Is going to be your child, your happy child, your happiness all the time. So please try to stay happy. But what happens is, today's stressful world, a lot of stresses are there, things are not under your control. Sometimes this happens, some bleeding is there. So you do some heavy work, laborious work, which ultimately results in some sort of bleeding or some sort of other disorder. You get a blow, you get a trauma. So due to that also, your child may be delayed afterwards. Perinatal reasons include your child is like normal delivery, it is cesarean delivery, it is a forced labor pain delivery, or it is a forceps delivery. So many things are there. So I told you normal delivery is the best delivery. So if it is possible, opt for that. But sometimes the things are not in control, you have to go for cesarean or forceps delivery. So at that time you have to take care whether your child is crying immediately. You have to note it down whether your child cried immediately. If a little delay in cry is there, your child may ultimately develop so many disorders. So remember to note it down whether your child cried immediately. Then afterwards, is there any neonatal jaundice, pneumonia, typhoid, or some diseases there for which you have to hospitalize your child for like 1 day, 2 day, 3 days. And initially these days, like the mothers are taking a lot of vitamins, folic acid and all these things. So normally all the children have physiological jaundice. So it is like by the exposure to sunlight or something, like it get treated. So don't you worry for that. But if it is like a pathological jaundice where you have to go for blood transfusion or so many things, so it is like very much alarming. So this is like postnatal reasons. It's come in that. So sometimes your child is hospitalized for something for quite few days. It may result in delayed speech and language. Then your child is like not sitting in time, delayed milestones are there, not standing in time, walking in time. So you have to note all those milestones also. Then sometimes what happens is, your like parents are very much busy, both are working. So what they do is, to avoid stress, what they do is take a mobile phone, give it to your child is busy in mobile, and you people are doing your activities, and he is not disturbing you. But remember, at this particular time he is not disturbing you, but afterwards he is going to disturb you too much because he is not speaking in time. Then you have to run to a psychologist, you have to run a speech therapist, you have to run to a occupational therapist, so many specialists you have to attend, and then you have to miss your work. So it is very good if you spare some time for him. Talk to him all the time. If you want the speech to be normal, don't make him dependent on TV, on telephone, on all other gadgets, iPads, etc. So it is very important to talk to him. So these are like postnatal reasons. And then if family disputes are there all the time, parents are quarreling, so many psychological reasons are there, and that is also a very big reason for the children not speaking. But TV and telephone these days, your children are turning into attention deficit hyperactivity disorder, that is ADHD, which I'll cover in some other video also. And then